Yeah, exactly, sir.
Hello? PDF to PPT. Okay, just give
Yes,
me
yes,
some
sir.
time.
Not a problem, sir. You can take it.
Mm. Is this okay now?
Yeah, this is perfect, sir. You can just go in the slideshow mode and it'll be fine then.
Yeah, fine. Oh, yeah. Okay. So, how do we start then?
Yeah, okay, sir. You can just try to change a few slides. You can use the cursor keys on the keyboard as well. That will be fine then.
Why it is not changing?
Yeah, sir.
So,
First, you can
not
go
able
to
to.
the left-hand side corner. There is the arrow option, sir. You can do that as well. Yeah, it's changing now.
Yeah, yeah.
Yeah, sir. Fine. You can keep the first slide open, sir, for your convenience, and then we can just begin.
Fine.
Yeah, sir. So I'll just brief you with the guidelines for the session before we start. So I will request your cooperation, sir, for our quality assurance process, and it is imperative that the framing of your video meets our quality standards. So I'll request you to maintain a stable position and ensure proper camera framing throughout the entire session. Also, please refrain from engaging in any other activities while the recording is live. And if you face any low network bandwidth, I'll recommend to share your presentation from your laptop. And for verbal communication, you can join the session using your mobile phone. So, your adherence to these guidelines will greatly contribute to the overall quality and effectiveness of the recording, sir. So once we stream live, I will start with a short introduction first, and then I'll hand over the session to you for your talk. And after your talk is over, we'll have a Q&A round. The questions which come from the delegates, I'll incorporate them in a PPT format and display it to you after your talk is over for a question and answer round, sir.
Okay, fine.
Yes, I hope that's fine.
Yeah, fine.
Okay. So just a moment, sir. We will be starting the live streaming shortly. Okay. So are we good to go live?
Yeah.
Okay. Thank you, sir. Greetings and a warm welcome to everyone. I am Asia, the assigned moderator from Clarnet. It is my sincere pleasure to extend a heartfelt welcome to all the delegates joining us from across the country. We are indeed fortunate to have the valuable support of esteemed doctors, and I express my gratitude to each one of you for dedicating your time to be with us today. Allow me a moment to introduce our platform Clarnet to you all. It proudly stands as one of the largest live digital continuing medical education platforms in India, providing a space for doctors to create and share medical content. Now, I would like to extend a special welcome to today's distinguished speaker, Dr. Pavan S.K. Sir, who is a urologist at Apollo Clinic, JP Nagar, Bengaluru. He holds the esteemed qualifications of MBBS and MS, along with MCH in urology and DNB in urology. With his expertise in urological care and commitment to evidence based patient centered treatment, Dr. Pavan brings valuable clinical insight to today's session. We are extremely delighted to have him with us today. And the topic for today's session is Global Standards in Robotic Urologic Surgery. So, without any further delay, I'm handing over the session to you, sir. Please proceed with your talk. Over to you.
So thank you, Clarinet, for giving me this opportunity to speak on something which I passionately uh, love, and what I've been practicing for quite a few years now. So we'll be dealing with the global standards of robotic urological surgeries in the present context. So with the advent of this robot, uh, so we have shifted from an era of open surgery to completely minimal invasive surgeries. The robotic surgery is the current global standard for complex urological intervention because it leverages specialized system that translates surgeons' hand movements into micro-scaled actions. So you can see in the image, the first picture is showing the console where the doctor is sitting and he is the operating, and the second part of the image shows where the patient is lying, and the robot you can see it is lying next to the patient, and these are the two assistants which are helping in maneuvering things, and the third would be a camera system where the assistant or the anybody in the OT can see what we are doing exactly. So it involves high definition 3D immersive visualization of the surgical field. So in the sense when the surgeon sits in the console and he puts his eyes into this console, and he can see everything exactly as it is in the abdomen in a 3D image. But compared to laparoscopy is just a 2D image, and this one is a 3D image where we can exactly point out where our instruments in the space. And the second thing would be the dexterity. So normally our hands cannot rotate 180 degrees, right? So with this robot, we can use twisted movements of wrist and offering 7 degrees of freedom. And it helps in controlling tremors, and it helps in doing steady suturing and all. The surgeon console, the picture that I showed you, it's a modern global standardized standards emphasize ergonomic surgeries. Surgeon operates from a seated console, viewing 10 times magnified 3D image. 3D image. This setup significantly reduces physical fatigue, allowing for consistent precision during multi-hour procedures like radical cystectomy. So every movement is mapped in real time, ensuring that remains the ultimate decision maker, while the robot provides a more stable interface. So this is what I explained you. That in the console, the surgeon can see an image which is 10 times magnified in a 10 times magnified view, and it reduces the neck strain, the hand strain, which we normally encounter in doing laparoscopic surgeries or open surgeries. In open surgeries, the surgeon has to bend his neck and see everything inside. But with the laparoscopy and in the robot, you just have to rest your head on the console. That's all. So, what are the advantages of robotic surgery? Because of this precise vision, even sub-millimeter small vessels and small nerves in the body, we can preserve it, and it helps in potency, and it helps in the preservation of continence and a lot many things, and even it reduces bleeding also. And because of the superior range of movements, that everything we can do suturing in a deep pelvis where it is difficult in both males and females. The pelvis in males will be very narrow. It is very difficult to put our hands into the pelvis. Even laparoscopy also, it becomes too tough, too difficult to reach that organ in that point in laparoscopy. But with the robot, we can simply suture it with ease. There won't be much of straining. Also, there won't be much of complexity. Also, it's a simple suturing that we can normally what we practice in our this one on table like that only we can do it on in a robo. And patient safety, because of this minimal blood loss and reduced risk of wound infection compared to the traditional open surgery, it helps in faster recovery and the patient will go get discharged early with a better clinical outcome. So, so these are the proven global outcomes. Nearly the robotics, with the advent of robotic surgery, we have seen nearly 85% of the reduced blood loss, and the hospital stay has come down to 1 to 2 days, and the recovery is three times faster. I'll give a simple example of is prostatectomy cases. The cancer in the prostate. Uh, so initially, we started with open surgery. Open surgery is a very morbid surgery for prostatic carcinomas, where we encounter a lot of bleeding, nearly 2 liters, 3 liters during the open surgeries. In the beginning, in the 1990s, when they started doing this robotic prostatectomies, open prostatectomies, there were a lot of blood loss, and the patient used to die on table or in the post-operative periods. So with advent of robot and all, the blood loss will be less than 100 ml compared to what it was in the open era of 2 liters to 3 liters. And even with open surgery, there will be a lot of patients who are incontinent. They'll be leaking in their pants. But with the use of robotic, we can achieve the continence, achieve the erections, potency, maybe the span of around 3 weeks to 3 months. The patient will have complete 100% continence, and the regain of potency will be around 50 to 60%. So for coming to the example of prostatectomies, so this is the most commonly done all over the world, the robotic assisted radical prostatectomy, because it is the gold standard for localized prostatic carcinomas. With the advent of robot, we can do nerve sparing, which helps in precise dissection of neurovascular bundles and the apical dissection to preserve the urethral length as much as possible. And with the advent of robot, we can completely remove the cancer where the margins will be negative and the patient will be surviving. Uh, the survival will be more. In the second option would be in kidney cancers where we encounter small tumors. You can see in this, there's a kidney where there's a small tumor of around 3 into 4 centimeters. So these are considered as small renal masses. With the help of robot, we can do all these surgeries with ease. In the traditional open surgeries, in the beginning era, we used to open the abdomen, nearly half of the abdomen we have to open. We have to take control of arteries, veins while cutting this tumor, and there is a lot of blood loss. Excuse me. And there's a lot of blood loss while cutting the tumor and all. With the advent of robot, we just putting small holes in the abdomen can can easily take this tumor out. And the robotic the with the robot helps in rapid suturing, which helps in which helps in the warm ischemia, which helps in the ischemia time, with a lesser ischemia time of less than around 20 to 30 minutes. So in case of open surgeries, we used to clamp the artery, and because whenever you do this kind of surgery, we have to take control of arteries or veins. When we come to take control of arteries in open surgeries, it would take around nearly 40 to 50 minutes of ischemia to the kidney, because when you clamp the entire blood supply to the kidney, the some of the nephrons in the kidneys will die. So if you reduce it little bit lesser, like around 15 to 20 minutes, we can give the maximum this one impact to the kidney. So kidney can survive. The nephrons won't be get damaged if you clamp the this one renal artery for quite a less duration. It helps in faster healing, and the kidneys also recover faster. And with this advent of robot also, just by doing putting a holes in the abdomen, we can do all these surgeries, and there will be no urine leaks, and there will be no wound infection which we encounter in open procedures. So this is just a small table which where we can compare the open surgery, standard laparoscopy, and robotic surgeries. The incision size in open surgeries will be 8 to 10 inches, which is large. The standard laparoscopy and robotic surgery, both the incisions are same. Vision is 2D. This is also monitor 2D, and the robotic is 3D image. The instrument freedom in the sense the rotation of the instruments, how to what extent we can rotate the instruments. The open surgeries we can fold just like an hand, we can twist entire thing like this. But in laparoscopy, it is limited. We can turn this much only, nearly less than 180 degree. But in robotic surgery, we can turn entire 270 degrees to 360 degrees, 270 to 360 degrees. The recovery period in open surgeries will be 6 to 8 weeks. Standard laparoscopy around 3 to 4 weeks. With the robotic surgery, minimal blood loss, no wound infection, 1 to 2 weeks. Mm. So, the global credentialing standard surgeons training is governed by strict global protocols like AUA, EAU. Competency is verified through tiered modular learning and simulation. So, the learning curve in robot, if a doctor wants to start practicing robotic surgeries, first thing is he has to have a robot. That is the first thing. And the second thing would be he needs a proper training because these are the instruments in a good hands, in a safe hands, everything will be safe. In a bad hands, everything safer can also become unsafer. So there is a proper training which there are so many companies which are recently has entered Indian market. The thing would be the Da Vinci is the market. It is the most commonly used robotic surgeries all over the world, and it's an American based company. So, and the second would be the SSI Mantra, which is an Indian company which is providing robots at a very good rates. So, many hospitals in many Indian hospitals, many government institutions in India are having a tie-ups with SSI Mantra. So they have a dedicated training modules where we uh, where they teach you how to handle the instrument. There will be around 15 to 20 sessions. You have to complete those sessions. Then only you'll be eligible to watch the surgery. The next would be the procedure proctoring. In the sense, in the first few cases, the proctor will be there and proctor will be doing the surgery. You have to see the surgery. The second thing would be you will be doing the surgery and the proctor will sit behind you and see how you are doing the surgery. Then you will be given a license. The final would be the mandatory registry reporting and quality assurance. When they gave license to you, then you'll be a competent surgeon, licensed surgeon who can operate a robot. The robotic urology growth trends. So, the robots are the cornerstone in urology nowadays. The maximum utilization is done by urologists where nearly because our organs like prostate, bladder, everything are deep seated, so they require this kind of an invention. So most of these robots are used by urologists. The second would be the gynae people where they also have to operate in the pelvic areas. Nowadays all specialties are accepting it and they're doing it in their own ideas, creating their own this one. But from the beginning onwards, robots are most commonly used by urologists. As you can see, that the cases which are done in the 2020 to 24, there is a steep increase in the utilization of robot and the cases being converted to robotic surgery. The future, what is the future? The future with the advent of AI integration and telesurgery and haptic feedback. So with the advent of AI integration, we are trying to see whether we can correlate CT, MRI, US PET, which helps in unsupervised learning or semi-supervised learning or learning from demonstration. The telesurgery, which has been nowadays, everybody's been every companies trying to pushing the telesurgery because one person sits in Bangalore and he operates the other patient in Delhi or in some other country. It is in the process, and many of the companies have achieved success without there is no lag in what they are doing it, and with a better patient safety and the haptic feedback because robot is just a machine. The machine cannot tell you ki how hard is the tissue, how soft is the tissue. Nowadays, till now, what we are doing is just with the have with the visual clues, we are assuming that this structure must be soft, this structure must be hard, and even suturing also sometimes because of robotic pull and all, the the chances of sutures getting cut are more. But with the newer adaptation of haptic feedback, this is the component which they have adapted in DaVinci 5 fifth generation, where we can feel the tension in the tissues. Even when we pull the tissues, we can feel the tensions. So this is one of the greater achievement I can say in robotic surgery, because it was one thing which was lacking in all these years. Now they have found a solution, and we are happy with it. So these are the future of robotic surgery, and the robotic surgery is going to stay for a quite a long period, and it is the next norm in India. So these are my image sources, and thank you, Clarinet, for giving me this opportunity. So I'm open for any questions. Hello.
Thank you very much, sir, for your wonderful talk. The presentation which you shared was really very informative as well as lucid, and it was delivered in a very clear manner, sir. Thank you very much for your time.